Hello, and welcome to A Swift View on Health. My name is Scott Shainvogel, and today I want to talk to you about just a few cost statistics that are important for any consultant or health benefits plan manager to keep in the back of their pocket. All right, let's dive in. The Kaiser Family Foundation has released their latest health benefits survey. And in that survey, there were a lot of news this past week on the fact that healthcare costs for employers, what they're paying on behalf of employees and their families, has reached all-time new highs. So I think that family coverage is now up over $27,000 a year in terms of what that's costing on average. And individual employee coverage is right around $10,000. And the rate of growth in those costs are something that has really also accelerated over the last several years. So if you looked at all of the different projections out there for 2026 in terms of how much healthcare costs would grow in 2026, what you can see here is that almost across the board, whether you're looking at Aon or Willis Towers Watson or the business group on health, somewhere between 8, 9, up to 10%, let's just call it 8.5 to 9 on average, that is the projected trend percentage of cost increase on an annual basis. And we don't really see in the next couple years a scenario where our costs are going to be any less than that. And a lot of things are going on. One, we've got GLP-1s. Those have driven up cost quite a bit. A lot of core cost is actually fueled by utilization. So when we're just doing more and more services, and we've talked a little bit about how our fee-for-service environment drives that behavior. And then recently, there's also been just a number of articles pointing out hospital pricing power. In almost every major city at this point, hospitals have a monopoly or something close to it, which gives them a tremendous amount of pricing pressure. All these are just three factors driving up high trend, high cost, but a lot of different things are going on. And if you are fully insured, meaning that you pay an insurance carrier to take on your risk and they pay your claims in return for you paying an annual premium each year, those cost increases have actually been going up even more, almost double, that 8 to 10%. We're seeing renewals for fully insured business growing 18 to 20% a year in many cases. And so you can see, across these major carriers, ranges that are suggesting, and I actually think these are conservative based on what we've heard. I mean, we've heard a lot of groups who are fully insured experiencing increases at a minimum of 25%, and some much more significantly than that. And so, being fully insured, can almost double the rate of your healthcare cost increases. And that is a dynamic where we see a flight from fully insured because of these costs to level funded or self-insured, which what's happening is that's really destroying the risk pool for fully insured business. Those populations are getting sicker, and thus the cost that everybody pays to be in that risk pool is just continuing to increase. And historically, we've tried to handle this by increasing, member out-of-pocket costs. And so we've had higher deductibles, we've increased payroll contributions, narrow networks. I think the general sense is across the industry is that we've taken that about as far as it can go. And so while almost every employer is planning some material amount of cost cutting, shifting that cost to employees, is probably a no-go. I mean, 1 in 3 adults can't even afford care now. 25% of those adults are skipping care, which ultimately leads to delays, higher acuity events, and more cost over time. So we've got a real challenge that we have to deal with in the marketplace. Now, obviously, we're going to continue to talk about that challenge, but with costs between 27,000 for families and around 10 for individuals, I think that if Aon kind of blended those together and said we're now spending kind of per employee, family versus individual, on average about $17,000 a year. Like, I just want you to have the tools to put in perspective how to think about those costs. And an easy way to do that and really try to understand like the risk of those trend rates without some significant action is that in a very short amount of time, your health plan costs, even when they're not even affordable today, may be on a path to double in just a few short years. And so an easy way to just kind of understand or calculate that is like, how soon is it before our costs are going to double? Is a rule from finance called the rule of 72. So if you just take 72 and you basically divide it by your trend or your growth rate, that equals the amount of time it's going to take to double your costs. So, if we're at 17,000 today and we end up at 34,000, like you can see in this little chart on the left-hand side here, is that if our trend rate was 6.5, probably our best case scenario today, we would still double our cost in 11 years. And if our costs are more 9 to 10% range, which I think is more realistic, we're looking somewhere between 7 and 8 years. Very little time for, once again, we have a significant ongoing increase in healthcare costs. So for everyone who's out there working to manage healthcare costs and trying to figure out the right strategies and what to do going forward, like we're at a place where, the time is now to do something significant in order to bring that cost under control. If you can't level out or decrease your costs and you continue to participate in the industry as it is today, obviously those costs are going to dominate, your expense profile as a family, as a business, and us as a country. So, really working hard to identify those right solutions, the cool new ideas that are going to help us, stay that trend and reverse it. And as always, thank you for joining today, and stay cool, stay swift.